Hello everyone. Very good evening to all of you. Am I clearly visible, audible? Let me confirm. If I'm clearly visible, audible, I will start the session. Am I clearly visible, audible? Very good evening to all of you. I guess I am. So, just a second. So I welcome you all for today's session. A very good evening to all of you, and I welcome you all for the second Prof Buster 2.0. In this batch, today we are having our first session of pharmacology. It's pharmacology free demo session, right? In which we are going to take a ultra important topic from the pharmacology. We will start from the scratch. We will start from the basics. I am going to start general pharmacology today, and that will be from the scratch. So can I start the session? How many of you with me? Can we start the session? Let me show my screen with you. Let me share it without wasting any further time, and let's start the session. So here you can see I welcome you all for the session that is second Prof Buster 2.0 in this batch, and today's session is pharmacology session, the first session of pharmacology in this batch, and we are going to start with general pharmacology in a very interesting way. I'm going to teach you general pharmacology today. Okay, but before I start, many students are new here and they want to know about this batch that is second Prof Buster 2.0. So in the next 2 minutes I'm going to orient you regarding the batch, and quickly, just in 2-3 minutes, I will come on the main topic that is general pharmacology in one shot. Okay, got it. Now in this batch, the second Prof Buster 2.2, this is our second batch of the second Prof, right? Now here me, Dr. Priyanka, I am going to teach you all three subjects of the second Prof, that is pathology, pharmacology, microbiology, in a unique manner, and that's the integration. Okay, and this batch is the foundation of your final year subject, that is medicine. Because if you combine these three subjects, it will become medicine, right? That's why the three subjects of the second Prof are ultra important. If you want to understand your clinical subjects, you have to understand paraclinical subjects very well, right? Now many students are asking what is the difference between second Prof Buster 1.0 and 2.0. Okay, the pre-recorded videos are already available. I know they are available, but here with this batch I am going to provide you a discipline, a structured schedule. I am going to cover the three subjects of the second Prof in 4.5 months. The end date is 22 March. Take my words, it will be 22 March. On 22 March 2026, we are going to pack the three subjects with 100% syllabus completion. Okay, and with your, now from second Prof onwards, your clinical postings also start, and with this batch you will complete your syllabus in 4.5 months, which you are unable to do alone because of lack of motivation, lack of discipline. Here in the live session on the structured dates, you have to come live 7:30 p.m. onwards, just for 2 hours. Not every day, it will be 4 days or 5 days a week. You have to come. The pre-schedule will be given to you. The pre-hand schedule will be given to you. And by completing the complete syllabus of the second Prof in 3 months or in 4.5 months in March, you will get sufficient time to start your pre-final and final subjects now only. So ask your seniors. It's always advisable to start these subjects in the second Prof, although very less students are able to do so. But please ask your seniors, is it advisable to start the pre-final or final year some subjects in the second Prof? The answer will be if you complete your second Prof subjects on time. So first focus on second Prof subjects. If you complete them on time, you are getting at least 2-3 months span. You can start the final year subjects or pre-final year subjects. It's always advisable. So with this batch, the second Prof Buster 2.0, I will make it happen. I will give you sufficient time to start these subjects early, because these three subjects I am going to cover on 22 March. And if you are joining the batch, you are also going to cover on 22 March. Got my point? That is the difference. And here in 2.0, the sessions are most updated. The notes are most updated. The question bank is updated. It is according to the latest standard textbooks, which are available now. And there are many updates from the last batch. Okay, now, many students say, is it batch for university exam or competitive exam? Now, please mind my words. The students who want to prepare only for university exam, please don't join this batch, because this course is comprehensive, elaborative course. It's not rapid revision. It's not rapid revision. Okay. It's a elaborative. It will be nearly 100 hours for each subject, approximately 80 to 100 hours. So it will be 250 to 300 hours course. So it is elaborative. It is more than sufficient for solving all the MCQs of competitive exam. It will be PYQ or the probable question to ask. Okay, don't take my words. Today I'm teaching you general pharmacology. Yes or no? After attending my session for 2 hours, you try your PYQs of university exam from your seniors and PYQ of the competitive exam from any question bank, any platform, any app you follow, and see the hit rate and let me know. Okay, take my words. Don't trust my words. You try by yourself. Okay, the course already started. The batch already started on 11th November and it will be ended on 22 March plus minus 10 days. But it will be end on March end. Take my words. The session will be live and it will be in the late evening 7:30 onwards. This is the detailed schedule. Okay, and the recordings will be available for 1 year. Now I'm going to teach you 3 subjects. Last thing, in an integrated manner. My course, the MedLive. Okay, MedLive by Dr. Priyanka. This course is India's first ever course in which the 3 subjects of second prof are taught in an integrated manner. Now, what is this integrated manner? It's not a fancy term. I'm using integrated manner. No, you have first understand what do you mean by integrated manner. I have given 3 colors to the 3 subjects. You can see red for patho, yellow for pharma, and green for micro. The color coding is done by me. Okay, now I have divided the systemic portion, systemic patho, systemic pharma, and systemic micro. The general portion we will complete in 20 days. After that, coming on the systemic portion, I have divided the human system into 12. The 12 major human systems you can see. So you have to study 12 systems in patho, 12 in pharma, and 12 in micro. I will not teach you subject wise. No, I will not teach you these 3 subject wise. I am going to teach you system wise in systemic portion of the 3 subjects. So for example, I'm starting with CVS. So first I will teach you diseases of the CVS and pathology. All the important diseases we will see. Congenital heart diseases, rheumatic heart disease. Then we will see the microorganisms causing infections like bacteria, virus, fungus and parasite causing infection in CVS. Okay, endocarditis and all. And then we will see the drugs for CVS and pharmacology. In this way, we will complete CVS from the 3 subjects. Same we will do with CNS, same we will do with GIT, likewise. This is the meaning of integration. So please understand, it's super useful for retention, and it will save your time. It will, eliminate the duplication again and again. The advantage is that, for example, in your college, CVS patho is going on. Okay, but your test is on pharmacology recipe and you are studying endocrine and microbiology, so it will be a mess in your mind. So what going in their college, what's the test, what's in the internal, the 3 subjects. That's why system by system, if you take it now, it will be better retention. Got my point? So you can see my detailed schedule. First 20 days in this batch, we are going to cover general of the 3 subjects. After that, you can see the color coding. Appreciate the color coding. We will go system by system. First patho, then micro, then pharma. CVS. Then recipe. First patho, then micro, then pharma. Then GIT. Patho, micro, pharma. Hepatobiliary, skin soft tissue, CNS, urogenital, endocrine, and miscellaneous. And the last date is 22 March. We will not even leave the miscellaneous topics, the minor topics. They will also be covered in this batch. The last thing regarding the notes. There are 2 types of notes available for this batch. The workbooks and the textbooks. Okay. Now this is for active learners and this is for passive learning. This is active learning. You can see they are exactly same. Workbooks and textbooks. What is the difference? Workbook 50% content filled, 50% fill in the blanks. Intentionally given by me so that you take the printout at your own cost. You please take the printout. The document is available on our app, on our website. You take the printout at your own cost if you wish. Okay. And fill it during the class. Take it during the class with the pen and try to fill it. If you try to take a blank notebook, you will not be able to cope up with my speed. That's why 50% is already filled. The 50% key words are missing. So that you fill, it will retain in your mind. That is for active learning. The one who want to make their own notes. The one who are passive learners or the one who want the ready-made material or the one who have less time left for the exam, you directly go with the textbooks. All the 3 textbooks are available for sale on our website and they are for separate purchase. They are not included in the pack. Okay, any other query will be entertained on the WhatsApp number. Please note down this WhatsApp number. Any other query, you can take the snapshot and note down the WhatsApp number and let's start the topic. Okay, with these brief introduction, let's start the topic. Can I start the topic? Let's start the topic, general pharmacology. Today's first session of pharmacology for this batch, general pharmacology. Now in general pharmacology, I want to teach you 4 chapters. One by one we will deal with. So I will teach you pharmacokinetics, which is the biggest chapter in general pharmacology. Then we will come on pharmacodynamics, in which we will see the receptors, transduction mechanisms. Then we will come on drug dosage and pharmacotherapeutics. And finally, we will come on clinical pharmacology, in which we will study regarding the trials. Okay, one by one we will study. So currently in today's session, I will be starting with pharmacokinetics. I call them PK and PD. These are the 2 biggest and most conceptual portion of the entire pharma. Now, believe or you don't believe my words. If you understand the general pharmacology well, understanding systemic pharmacology will be cakewalk for you. If you are missing the general concepts and the foundation is missing, how you can build a building without a foundation? So general pharmacology is very important. Most of the students skip this portion and they directly try to jump on ANS, CVS drugs, and it will be a bouncer for you. Obviously, it will be a bouncer. No, you don't have the foundation. So that's why focus on the foundation first. So PK and PD, I mean pharmacokinetics and pharmacodynamics are super important, people. You can't afford missing them. So can I start my first chapter today? How many of you are ready? Give me a thumbs up, everyone. Give some emoji. Give a gesture that you are getting it, understanding, and you are alive. So let's start with pharmacokinetics. After completing pharmacokinetics, we will come on pharmacodynamics. But let's start with pharmacokinetics. So today's session is pharmacokinetics. Everyone, people, am I live? Say something. Pharmacokinetics. Let's start it. In pharmacokinetics, we divide our session into 4 portions: absorption, drug distribution, drug metabolism or biotransformation, one and the same thing, and drug excretion. One by one, we will see it. Acha, before I start pharmacokinetics or pharmacodynamics, pharmacokinetics, that is PK, or pharmacodynamics, that is PD. Before that, you must start from the scratch. I am assuming that you don't know anything. I am assuming that. Let's start from the scratch. What is pharmacology? Pharmacology. Start from the very scratch. My subject today is pharmacology. My first session of pharmacology. You tell me, what is pharmacology? Pharmacology is a science of drugs. It's a science of drugs. What is pharmacology? It's the science of drugs. So my first session for pharmacology today. And it is having 2 branches: pharmacokinetics, pharmacodynamics. I call them PK and PD. Pharmacokinetics and pharmacodynamics. You are getting my point. Now first you understand what is the basic difference between them. What is pharmacokinetics, that is PK, and what is pharmacodynamics, that is PD. First you understand their basic difference, then we will start pharmacokinetics in detail today. Pharmacodynamics will be taken tomorrow, but today we will deal with pharmacokinetics. Okay, now the basic difference: pharmacokinetics is what the body does to the drug. What the body does to the drug. And pharmacodynamics means what the drug does to the body. What the drug is doing to the body. Let me explain. Let me explain in a simple language. Okay, I forgot my capsule. Suppose, okay, this is the GIT. Can you see here? The complete GIT of a normal human being. It's my GIT, a healthy human being. Can you see the GIT? Yes. Okay, I will show you video also. Wait. So this is the GIT. Suppose it's a normal human GIT. It's my GIT. Okay, suppose I am taking a drug. Okay, a tablet or a capsule or a syrup, any formulation from oral route. This is my mouth, oral route. Suppose with a sip of water, suppose I'm having a tablet or capsule, I'm keeping in mouth and taking with the sips of water. Okay, so what will happen? See the drug, everyone see the drug. I have drawn here with blue dot. So the drug will go inside. First it will go in my mouth, okay, then it will go in my pharynx, larynx, then it will go in the esophagus. It will go in the esophagus, in the mouth, then in the pharynx, and then it will go in the esophagus. From the esophagus, it will go in the stomach. From the stomach, it will go in the intestine. So suppose this is the tablet. Please understand, I'm taking it, I'm keeping in the mouth, okay, or I'm taking any drug from oral route. I'm taking with sips of water. So where it will go? The tablet will go in my mouth, it will go in my esophagus, it will go in my stomach, it will go in my intestine. Okay, from the stomach and intestine, it get absorbed. Okay, it get absorbed. Now stomach have acidic medium, stomach have HCl, it is having acidic medium. So it's a rule. I will explain in later half of the session. Acidic drug get absorbed from the acidic medium and basic drug get absorbed from the basic medium. Intestine have basic medium. So there are 2 type of drugs. I will explain. Okay, the electrolytes, acidic and basic, weak electrolytes. So acidic drug get absorbed from the acidic medium and basic drug absorbed from basic medium. Forget it. Whatever is the drug, it is getting absorbed either from stomach or from intestine, depending on the nature of the drug. Okay, depending whether the drug is acidic in nature or basic in nature, ultimately it's going to be absorbed. Okay, either from the stomach or from the intestine. So where does the drug reach after absorption? After absorption, the drug reach in the blood. You know, mesenteric blood vessels, the blood, it is reaching in the blood. Can you see? This is the drug. Let me draw with blue only. So this is the drug. It is reaching the blood. So this is known as absorption. What it is known as? Absorption. The first step is absorption. This is the site of administration. Okay. And this is circulation. Blood means circulation. So the movement of the drug from administration to circulation. This is known as absorption. What is drug absorption, people? What is drug absorption? Tell me the definition of absorption. Absorption is movement of drug. From where to where? From where to where? The drug is moving. The drug is moving from the site of administration to circulation. This is known as absorption. The administration can be via various route. It is not always oral. Okay, it can be subcutaneous, it can be intramuscular, it can be intradermal, it can be rectal, it can be vaginal, it can be various routes. I will teach you routes of drug administration also. But via whatever is the route, ultimately it reaches the circulation. Via all route, ultimately a proportion of the drug is reaching the circulation, and this is known as absorption. Okay, ji, the drug reached the circulation. Drug already reached the circulation, but for what purpose we are taking the drug? We are not taking the drugs as it is na ki chalo aaj man hai ek drug le lete hain. No, it's not like that. We are having some disease in the body. Suppose I'm having migraine headache. Suppose I'm not having, but suppose I'm having migraine headache today, for which I'm taking a drug. This is the drug, I am taking it. Okay, so what will happen? This is the drug for my migraine. So I am taking it. It will go inside, it will reach my stomach, it will reach my intestine via esophagus. So if the drug is acidic, it will absorb from the stomach. If the drug is basic, it will absorb from my intestine. So ultimately it will reach in my blood. So absorption is done. Now from blood, where it will go? Okay, so the various drugs have receptors in the body. Okay, so if I'm taking a drug for migraine, it is supposed to go in the cranial blood vessels and act on the receptors. Okay, suppose I'm taking a drug for diarrhea or constipation. So it is supposed to go in the intestinal receptors. If I'm taking a drug for the heart failure, it is supposed to go on the heart and, myocardium of the heart or whatever. It will act on its receptor. So drug, blood go everywhere. So via circulation, the drug is going everywhere. Wherever it is having its receptor, it will go and enter in that organ, bind with that receptors. So that is the site of action. That is the site of action. So drugs for diarrhea go in intestine. Drugs for migraine go in cranial blood vessel. Drug for heart failure will go in the heart likewise. Okay. So we take various drugs for various disorders. The drug is having receptors on that organ. So the movement of the drug from circulation to organ, it is known as distribution. The second step, distribution. It's also movement of drug. So absorption and distribution both are movement of drug. Please understand. What is absorption? What is distribution? Who will tell me? What is absorption? Absorption is movement of drug from site of administration to circulation. Distribution is movement of drug from circulation to its site of action or to various organs. How many of you got it? How many? Now drug, suppose I am taking a drug for migraine. I have taken it. It will go inside. It will go in my esophagus, stomach, intestine. It get absorbed. Absorption is done. It will go in blood. From the blood, it will go to the cranial blood vessel and treat my migraine via whatever mechanism. It will show its mechanism of action over here. Mechanism of action is pharmacodynamics. Okay, I will come on that. It is pharmacodynamics. It has shown its action. My headache is relieved. My migraine headache is relieved. Or my diarrhea is relieved. My constipation is relieved. My head failure is treated. For whatever supposed, we are supposed to take that drug. That disorder is treated. That disease is symptomatically or curatively, it is treated. Now, drug has done its job. For what purpose we have taken the drug? Drug is done. Now, once I take the drug, it will not remain forever in my body. I have to excrete it. Okay, once it has done its job, I have to excrete it. If the drug is for migraine, once it will go inside, go in the blood. From the blood, it will go to cranial blood vessels. It will relieve the migraine, treat it, show its mechanism of action. Now I'm supposed to excrete it from the body. I cannot keep it forever. So it will again come in the blood. It will come again in the blood. Okay, from the organs, it will come again in the blood. From the blood, it is supposed to go in the kidney. 99% of the drugs are excreted in urine. So I want excretion, okay, of the drug from the body. So what is the last step? The last step is excretion. What's the definition of excretion? Excretion is again movement of drug. Movement of drug out of the body. Movement of drug out of the body. So, but in between distribution and excretion, we have one more step. Listen, there is a problem in excretion. You see, ma'am, what is the problem in excretion? Excreted now. The drug has already distributed. The drug has already shown its mechanism of action. Now, what's the problem? Why you are not excreting it? Let the drug go to the kidney. Kidney will excrete it. No. Kidney is having terms and conditions. Kidney is having some terms and conditions. What are the terms and conditions? Kidney say, I will excrete only polar drug. Because from kidney, urine comes out. And urine is liquid. Urine is water. Everyone knows. What is urine? Urine is liquid, water. So if the drug is polar, it will be soluble in urine and it can get out of the body via urine. Okay, it will get dissolved in the urine. But suppose the drug is non-polar, what will happen? Kidney is not able to dissolve it in the urine. It cannot come in the form of the crystals in the urine. Obviously, it get dissolved, then only it will come soluble form in the urine. So non-polar drug, kidney will not excrete. Kidney say, I'm having terms and condition. Okay. I will excrete the drug if you give me polar drug. If a polar drug come, I will dissolve it in the urine, get it out. But if a non-polar drug come, I will not excrete it. You first convert it into polar, then send it to me. So we asked the liver, we requested liver, will you convert a non-polar drug to polar drug for us so that we can get excreted? It has already shown its action. Now we want the drug to get convert from non-polar to polar. Liver have hepatocytes inside it. The cells of the liver are known as hepatocyte. Inside the hepatocyte, there are enzymes. I will tell you the name of the enzyme, CYP450, most common enzyme. That will say, yes, yes, I will convert the non-polar drug to a polar drug. And this step is known as metabolism. So from the organ, site of action, first it go to the blood. If it is non-polar, it will go to the liver. In the liver, it will get converted from non-polar to polar. And this step known as metabolism or biotransformation. Biotransformation and metabolism. Okay, what is biotransformation and metabolism? It is conversion of a non-polar drug to polar drug. And after that, this drug again come in the blood. Via blood, it will go to the kidney, and from kidney, it get excreted. So body is doing 4 things to the drug. People, focus. No one will explain you from the scratch. People directly jump on high fundas. Okay. And that goes bouncer for you. I know why it goes bouncer. Because I understand like this method. Someone should teach me from the scratch. Okay. So I'm teaching you all the things from the scratch, people. Please understand. So there are 4 things body is doing to the drug. What body is doing to the drug? Body is first absorbing the drug. Then body is distributing the drug. Then body is metabolizing the drug. And finally, body is excreting the drug. These 4 things are the 4 branches of PK, pharmacokinetics. That's I'm going to teach you today. Everyone give me a thumbs up. What are the 4 branches of pharmacokinetics? Absorption, distribution, metabolism, and excretion. How many of you got it? So first tell me, what are the 4 branches of PK? What are the 4 branches of PK? Again, I will tell you the same story. Everyone on the screen. Everyone. So I am having a migraine headache. I am not having it as an example. People, I am having a migraine headache. Okay. For which you are a clinician. I am coming to you. Doctor, I am having migraine headache. It's very frequent nowadays and it's, disturbing my daily life. And you are giving me a drug. Ma'am, take this drug. You will be all right. It's oral form. It's a tablet. I have taken this tablet. I am relying on you and you have given me the tablet. Suppose I am having the tablet. And this is a glass of water. I am keeping it in my mouth and taking the sips of water. So the tablet goes inside me. So this is oral. This route, the most common, most convenient, cheapest route is oral. So this is drug which is given via oral route for any disease, not only migraine, it can be for any disease. Okay, the drug goes in the mouth. From the mouth, it goes to esophagus. From esophagus, it goes to stomach. Appreciate stomach. And then it goes to intestine. Okay. Now, some drugs get absorbed from stomach, some get absorbed from intestine. Now, which get absorbed from stomach, which from intestine, I will come on that today only. Wait a while, you have to be here. Ultimately, it get absorbed and reach the blood. Ultimately, mesenteric blood vessels. The drug is reaching the mesenteric blood vessel and this is known as absorption. So, what is absorption? Who will define me? Absorption is the movement of drug from where to where? Movement of drug from the site of administration to circulation. Okay, it is known as absorption. Absorption is movement of drug from where to where? From where to where? From the site of administration to circulation. And this is known as absorption. Step number 1 of PK. Body is absorbing the drug. Now drug reaches the circulation. Where it will go? What is circulation? Circulation is blood. It is throughout the body. Every organ is getting the blood. Okay. Now, this drug is having receptors on some particular organ. If it is for migraine, it is having receptor in the cranial blood vessel. If it is for diarrhea, it is in intestine. The receptors in intestine. If it is for constipation, it is again in intestine. If it is for heart failure, the receptors are in the heart. Okay, so it will go to its site of action wherever it is having the receptors. Okay, so movement of drug from circulation to site of action. This is known as distribution. The second step, distribution. Second step of PK. Okay, so what is distribution? Distribution is movement of drug from where to where? From circulation to site of action or various organs. So this movement is known as distribution. How many of you got it? This is distribution. Now drug reached at the site of action, what it will do? It will show its mechanism of action. It will treat the disease, cure the disease. If it is for migraine, it will treat it. If it is for diarrhea, constipation, heart failure, it will treat it. How? That is not today's chapter. How it will do so, that is tomorrow's chapter. This is PD, Pharmacodynamics. I will teach you tomorrow. So mechanism of action comes in pharmacodynamics. What the drug is doing to the body. Okay, that I will teach you tomorrow. This is pharmacodynamics. Let's complete pharmacokinetics first. Okay, so this is movement of drug from circulation to site of action is distribution. Now, drug have treated the disease, cured the disease for whatever purpose it was supposed to do. It is given, it has done that. Now, what we want? If I have taken a tablet, it cannot remain in my body forever. Oh my God. No, it cannot. I have to excrete it. Okay, once the job is done, relieve it, excrete it. So we want this drug to go in kidney and get excreted out. Get excretion is the last step. What is excretion? Movement of drug out of the body. But kidney says I am having a term and condition. I will excrete only polar drugs. The drugs which are soluble in urine. Soluble, urine is water. The drugs which are soluble in water, I will excrete it out of the body. I don't have any problem. But the drugs which are non-soluble, how I will excrete? Urine is liquid. If the drug will not dissolve in urine, how the drug will come out from the urinary tract? No, it will not come out. So if you have a non-polar drug, first let it convert from non-polar to polar, then give it to me, then I will excrete it. So we have a problem. Most of the drugs are non-polar. Okay, so we will request liver. Liver, will you convert a non-polar drug to polar drug? Liver say yes. Inside my hepatocyte, in the endoplasmic reticulum of my hepatocyte, I am having enzymes. Okay, microsomal enzyme that will do the conversion. No worries. You send the drug inside me. So the drug is going in the liver and getting converted from non-polar to polar. So this step is known as metabolism, also known as biotransformation. The third step. So what is the third step? Third step is conversion of drug from non-polar to polar inside the liver. Non-polar to polar inside the liver. And once it get converted, it will go to the kidney and the kidney will do movement of the drug out of the body. That's excretion. So what are the four parts of pharmacokinetics? What body is doing to the drug? Body is first absorbing the drug, then distributing the drug, then metabolizing or biotransforming the drug, then excreting the drug. So what body is doing the drug is the pharmacokinetics. These are the four parts of PK. Okay, PK have four parts. What are the four parts? Okay, some people learn in the form of a mnemonic. What are the four parts of PK? Absorption, distribution, metabolism, and excretion. You can learn a mnemonic if you need. It is ADME. ADME in the sequence. Body first absorb the drug, then distribute the drug, then metabolize, also known as biotransform. Don't forget. Metabolism and biotransformation is one and the same thing. And finally, body excrete the drug. So these are the four steps. Body, human body, my body. Body does to the drug. Body doing to drug. What drug doing to the body? Drug doing to the body is only one thing. What's that? What's that? Drug show mechanism of action in the body. And that's pharmacodynamics. So pharmacodynamics have only one branch marked by green color. That is mechanism of action. But pharmacokinetics have four branches. So what we have learned, people, we have learned pharmacology. I will show you videos now. Wait, don't go anywhere. Pharmacology. What is pharmacology? Pharmacology is the science of drugs. Okay, start from the scratch. Pharmacology. It is a science of drug. It is having two branches. What are the two branches of pharmacology? Pharmacokinetics, pharmacodynamics. They are known as PK, PD. What is pharmacokinetics? What body does to drug? Does to drug. What bodies does to drug? Okay, and what is pharmacodynamic? What drug does to the body? What drug does to body? Does to body. You can learn with the help of a mnemonic. Pharmacodynamics have D and drug have D. Okay, D for D, you can learn like this. Okay, here there are four branches and here there is one branch. So what the body does to the drug? Body first absorbs the drug, then distribute the drug, then metabolize or biotransform the drug, and finally excrete the drug. Okay, so what drugs do to the body? Drugs do only one thing, that is mechanism of action. Shows its mechanism of action via various receptors, enzymes, or transducer mechanism. How many of you got it? How many of you got it? What is absorption? Movement of drug from where to where? From site of administration to circulation. What is distribution? Again, movement of drug from where to where? From circulation to site of action. To site of action. What is metabolism? It happens in liver. Liver convert a non-polar drug to polar drug. Okay, and this is known as metabolism. And what is excretion? Excretion is movement of drug out of the body. Movement of drug out of body. Okay, and that is known as excretion. People, how many of you got it? Everyone got it? Huh? Now I will show you the videos for PK. So today I am going to teach you PK. In tomorrow's session or a day after tomorrow's session, we are having 3 episodes. So in last episode number 3, I will come on PD. For the first and second episode, today and tomorrow, we will focus on PK. And finally, we will come on PD later on. How many of you got it? You can see. These are the 4 steps of PK. This person is taking the tablet, so first absorption. This is how absorption occurs. It goes in circulation. Then distribution, it is going in various organs. Then it is going in liver. This is liver. It is entering the liver, getting converted from non-polar to polar, and finally it will get excreted out of the body. This is what body does to the drug. This is PK. This is PK. What bodies do to the drug. This is what drug does to the body. At the site of action, drug go and bind with the receptor and show mechanism of action. So this is PD. PD mein what the drug is doing to the body. How many of you got it? In one more video, I would like to show you. See, this is site of absorption. Site of administration, oral route. The drug is going in circulation, so this is absorption. From circulation, it is going to site of action. This is distribution. From where it is going to liver. In the liver, it gets converted from non-polar to polar. This is metabolism. And finally, it is going to kidney and get excreted out of the body. How many of you got it? If you want this diagram, in the books, this diagram is given. Nowhere this diagram is given. This diagram is my creation and I have drawn it. So whatever diagram you find easy for understanding, you can go with that. How many of you got it? How many of you got it? Huh? Got it? How many of you are ready for the questions? Give me a thumbs up. The one who are ready for the questions. The one who are ready for the questions. How many of you are ready for the questions? I will show you a question. You have to write down the answer in the comment box. You will be given 15 seconds to write the correct answer in the comment box. Okay. So please be fast and be correct. Let me see who is first and who is most, correct to first answer it. The first question is in front of you. PD deals with pharmacodynamics. Pharmacodynamics deals with what? It is the effect of drug on body or effect of body on drug? Or is it absorption of drug or metabolism of drug? What is the correct answer? People who will tell me. Absolutely right. Most of you are correct. The first to answer is Amsing. Okay. Congratulations, Amsing, and everyone is correct. The correct answer is it is the effect of drug on body. Okay. Pharmacodynamics. D for dynamics, D for drug. This is how you have to learn it. The next question is in front of you. Pharmacodynamics include, again PD. The question is on PD. PD include what? PD include drug elimination, drug excretion, drug absorption, or mechanism of action. What does PD include? Who will tell me? Very easy. What does PD include? Absolutely right. Absolutely right. Again, Himaya first to answer. So correct answer is mechanism of action. Okay, so I told you in PK there are 4 branches, but in PD only one thing. Okay, now let's start pharmacokinetics. With this introduction, I would like to start my session and I would like to start pharmacokinetics today. Tomorrow also we will continue with pharmacokinetics because these 4 things we have to deal here. It's a big portion. I must say it is one of the biggest portion of your pharmacology. You see the number of pages in your standard textbooks. Pharmacokinetics. Pharmacodynamics is relatively small. That we will take a day after tomorrow. That is in episode number 3. So today, tomorrow, and a day after tomorrow, the 3 days, complete general pharmacology in one shot. Don't you ever dare to miss the next 2 sessions. Okay, chalo. Today we will start with pharmacokinetics. Okay, what is the definition of pharmacokinetics? Everyone knows it is what the effect of body on the drug, what the body is doing on the drug. Body doing 4 things. It is having 4 parts: absorption, distribution, metabolism, and excretion. You understood what is absorption, distribution, metabolism, and excretion. ADME is the mnemonic you can learn if you want a mnemonic. If you don't want a mnemonic, I have explained twice. What does it mean? The 4 portions, you can see it here. So let's start with absorption today. Okay, today we will start and finish absorption and maybe distribution. These 2 we will be dealt tomorrow. Okay, all the 3 sessions are free demo sessions. Okay, chalo. Absorption. Can I start absorption? One by one, we will see the 4 things of PK, pharmacokinetics. Absorption, distribution, metabolism, and excretion. Let's start absorption. What's the definition of absorption? You already know. What's the definition? Movement of drug from where to where? From the site of administration to circulation. Very easy to learn. I mean, you don't have to learn if you have understood. So if the drug is taken via oral route, it will go in the esophagus, it will go in mouth, in the esophagus, in the stomach, in the intestine. The drug will absorb from the stomach or intestine. There are 2 organs from which the drug absorb. Some drugs absorb from stomach and some absorb from the intestine. Whatever. Okay. Ultimately, drug reaches in circulation. So movement of drug from where to where? The movement of drug from administration to circulation. This movement of drug is known as absorption. Everyone got the definition? Give me a thumbs up. This is drug absorption. Now tell me, there are any factors which affect absorption? There are any factors which affect drug absorption? Say yes, say no, but say something. Are there any factors which affect drug absorption? Yes. There are 9 factors which affect drug absorption, and you get MCQs very frequently on that. Especially the most toughest and trickiest to understand is the effect of pH, ionization and effect of pH on the absorption. Okay, so I will explain the first 8 very quickly. They are easy to understand. And the ninth one, the ninth factor, we will see in detail. Got it? These are 9 factors which affect drug absorption. You got the definition? You have to understand 2 things over here. 3 things over here. Number 1, first tell me the definition of absorption. Then tell me the factors. There are 9 factors which affect absorption. And then tell me bioavailability. Bioavailability, what it is related to absorption. If these 3 things are done, we will come on distribution. Okay, definition is done. You know the definition. What is absorption? Movement of drug from the site of administration to circulation. That is absorption. These are the 9 factors. One by one we will deal it. The first factor is aqueous solubility of the drug. Okay, what do you mean by aqueous solubility? The drugs, as soon as, aqueous solubility means dissolvement in water. We take the drug with water, water, juice or some liquid. It contains water. So if I am taking a drug with water, the drug also go in my stomach, the water also go in my stomach, and in the stomach it should dissolve like this. In the stomach or intestine it should dissolve. Suppose if the drug is not dissolving in the water, okay, how it will get absorbed? It will not get absorbed in tablet or capsule form, no? It should dissolve. Okay, that is aqueous solubility. The solubility in water. The rate of absorption is directly proportional to aqueous solubility. The drugs which are more aqueous soluble, water soluble, are faster absorbed, okay, as compared to drugs which are less water soluble. Suppose we are taking 2 drugs. I am taking 2 drugs. Tablet A, tablet B. Drug A, drug B. Both are going inside. Drug A is more soluble in water and drug B is less soluble in water. Both will go. Both I am taking with water. So both are reaching in the stomach and intestine. In the stomach and intestine, drug A quickly absorbed in water and get absorbed. Drug B is slowly absorbing in water. So it is slowly absorbed. Common sense. So aqueous solubility is directly proportional to rate of absorption. Rate of absorption is directly proportional to aqueous solubility. If a drug is not in the solution state, if we are taking directly syrup, syrups are also available. I'm having many syrups over here. So syrups are there. Syrups means, what do you mean by syrup? It's already liquid. So if the drug is taken already in liquid form, its soluble form, it will directly get absorbed. There is no question of solubility. But if the drug is taken in solid form, like the tablets, capsules, granules, so its rate of absorption in the intestine, it depends on aqueous solubility. Okay, tablets which rapidly disintegrate and absorb, they rapidly absorb. I hope everyone got the first. Okay, so rate of absorption is directly proportional to aqueous solubility. The second is formulation. What do you mean by formulation? Drugs are available in various formulations. Some are tablets, some are capsules, some are syrups, various formulations. Some are patches. I will teach you various forms. So various forms are available. Okay, now suppose there is a tablet. Suppose. So tablet contain the active ingredient. Of course, it contains the active. Suppose there is a tablet of paracetamol. So it contains paracetamol. The active ingredient is paracetamol. But to package it, to make a tablet, to compact it, we have to add some inert substances also that are not active ingredient. We have to add some inert substances like the lactose, sucrose, starch, calcium, lactate. Okay, to make it a tablet form, to compact it and make it a tablet form, we have to add some other substances which are known as inert substances apart from the active ingredient, whatever it is having. How many of you got it? So they also affect the absorption. The various ingredients have various effect on the absorption. That is a formulation. How many of you got it? So if you see the ingredients of any tablet, if you are purchasing any drug from the market, the composition is written on that. If you read the composition, of course it contains the active ingredient for what you are taking. If you are taking paracetamol, it contains paracetamol, but it contains something extra also to package it. And that are the inert substances that will affect the rate of absorption. That is the second thing. The third thing is the concentration of the drug. How many of you got it? So first is aqueous solubility, second is formulation, third is concentration of the drug. Okay, rate of absorption is directly proportional to concentration of the drug. If the drug is more concentrated, it will be rapidly absorbed. If the drug is less concentrated, it will be slowly absorbed. So obviously, common sense. So if I'm taking a tablet, how many sips of water should I take? I should take 1, 2, 3 glass. Oh, it will go. Or I should take 3, 4, 5 sips or half glass of water. So which will have faster absorption? If I'm having high grade fever, I want to take paracetamol. I'm taking paracetamol 500 grams. I'm taking it. So I want it to quick action. It will show quick action only if it will get quickly absorbed. It will reach my blood and show its action. On the hypothalamus, it will go and show its action. It will reset the thermostat and control the temperature, bring it back to normal. But it will reach the hypothalamus only, it will go to the blood. It will go to the blood only if it get absorbed. So how much water should I take? I should take more water or adequate or less, not very less. I should take at least it should dissolve. I should not take one sip so that even it don't dissolve, it remain compact only in my stomach. No. I should take half glass of water or 5, 6 sips so that it get dissolved in the water, in the stomach. I should not take much concentration, it will get dilute. Once it get dilute, absorption will be slow. But if it is of high concentration, absorption is faster. How many of you got it? So this is all the things being a doctor you should know before prescribing any drug to your patient. You should give the clear cut instructions to your patient, being a good practitioner. How many of you got it? So rate of absorption is directly proportional to concentration of the drug. More concentrated, fast absorption. Less concentrated, slow absorption. Okay, so drugs given in concentrated form are absorbed faster than the drugs which are given in dilute forms. So that is the third factor. The fourth factor is lipid solubility, ultra important. Some drugs are lipid soluble, some are not lipid soluble. Whenever you take any drug, okay, you see, most of the drugs are taken by oral route. So this is the stomach, okay, or intestine. So these are the cells of the stomach, lining the stomach, mucosal cells. And these are the mucosal cells of intestine. And this is blood vessel. Okay, these are the endothelial cells lining the blood vessel. Okay, now this is my drug. I have taken. It is in my mouth. From the mouth, it's going in esophagus. Okay, mouth, esophagus. Ultimately, it reaches stomach or intestine. Okay, how it go to the blood? So it will go to the blood. It has to cross the cell. It will go in the mucosal cell of the stomach, and then it will go in the endothelial cell of the blood vessel, and then it will come in the lumen of the blood vessel. You are getting my point, what I mean to say. So it has to cross the cell membrane. First, the mucosal cell membrane, it will be in the mucosal cell, lining cell. Then it will go in the endothelial cell, and then it will go in the lumen. So it is crossing the cell membrane 2, 3 times, multiple times. You can see cell membrane here also, here also. Cell membrane are made up of lipid. I guess everyone know by layer, lipid. Cell membrane. So if this drug, now please focus, if this drug is lipid soluble, it can cross this membrane, okay, and will go inside the cell and will go inside the endothelial cell and come in the lumen. But if this drug is non-lipid soluble, it cannot cross the cell membrane and absorption will be slow. So that matters, the lipid solubility. I hope you are getting it, people. I'm trying very hard. You are getting it. So you can see this is the cell membrane I have shown you here. Okay, this is the cell membrane of these cells. Now you are getting it. These cells, or you can say endothelial cells. This is the cell membrane. So drugs which are lipid soluble, they can cross the cell membrane and move on the other side. So the drugs which are lipid in nature are lipid soluble. They are permeable to the cell membrane and they are absorbed better. So rate of absorption is directly proportional to lipid solubility. Lipid solubility. The drugs which are more soluble, lipid soluble, are faster absorbed. The next is surface area of the absorption. What is the surface area? So what is the surface area? You have ever thought? God. You believe in God? The great God, the Almighty, whatever God you believe. Okay. So you can see why God has given us villi. You know what is villi? This is intestine. Let me draw the intestine. In the intestine, the lining of the intestine is like this. It is known as villi. On the villi, we are having microvilli. So villi, why God has given? God is not doing anything without a purpose. Everything have a purpose. The only thing we don't understand it. Huh? So why God has given us villi? To increase the surface area. Suppose there is anything, food or drug present in the intestine. So the surface area is increased now by giving the villi. Instead, if it was flat, imagine if there was no villi, it was flat. So the surface area is only this. The surface area is only this. But by giving villi, we have increased the surface area. The God has increased the surface area. You are getting my point. So more is the surface area, the drug will be absorbed very fast. Less is the surface area, the drug will be absorbed slow. Look, you know, there are certain diseases known as celiac disease. I teach you in pathology, celiac disease, in which there is flattening of the villi. If the villi get flattened, the surface area reduces and absorption don't happen, and it's a type of malabsorption disorder, celiac disease. Okay. So surface area, more is the surface area, more is the absorption. You can appreciate the villi over here. Okay, intestine have the villi. So that is the surface area. The sixth factor is motility. You know why God has given us peristalsis? Have you heard about peristalsis? What is peristalsis? Peristalsis. This is peristalsis. What is peristalsis? Appreciate. Can you appreciate the rhythmic movement, the waves in the entire GIT? Okay, so you know, if something is stationary, suppose this is a lumen of intestine, this is the lumen of intestine. Here is something, food or drug. Here is something, food or drug. Imagine this one is stationary. Okay, it is stationary. So drug will absorb at a constant speed. But imagine this one is having the waves. Okay, this one is having the waves, the peristalsis. So there are more chances the drug will come in contact with the surface area very quickly and it will get absorbed. Okay, so peristalsis or the motility of the GIT have a role in absorption of the drug. So more is the peristalsis, faster is the absorption, because motility brings drug rapidly in contact with the surface area as compared to a non-motile area. So there are certain disorders, you know, motility disorders. Have you heard about achalasia? Achalasia cardia, I teach you in GIT in pathology, yes or no? So this is the way we integrate the things, people. So in which there is problem in the motility. Okay, so drug absorption will be slower in that case. The next seventh factor, presence of other substances in the GIT. Food. Now you are doctor, of course you will be, I mean, practicing doctor. You all are doctors, but once you will get your license, your degrees, you will start practicing. You will start treating patients. You will start prescribing drugs to the patient depending on their disease. Okay, whenever you prescribe any drug to any patient, you know the first question patient asks you, doctor, shall I take it with food or without food? Very frequent question patient asks. You cannot be like very casual, whatever you want you take it, like it will be work both. No, you should be very peculiar about that. So food, presence of other food in the stomach, what is the effect on absorption? What is the effect on absorption? Now use your common sense. Use your common sense. Suppose this is the stomach and suppose this is the stomach. Okay, both are stomach. This stomach is full. It is having food, already having food inside it, and this is empty. This one is empty. Okay, it don't have anything. Here the drug is taken. Drug goes inside. Here also drug is taken. Drug goes inside. You use your common sense. Where will be absorption faster? Common sense, obviously. Absorption will be faster in empty stomach because there is nothing to hinder. Quickly, the gastric mucosa will absorb it. There is nothing. But here gastric mucosa have to absorb food also, have to absorb drug also. Okay, so here the absorption is slower. Here the absorption is faster. So general rule you can see, food delays absorption. Food always delays absorption, but there are certain foods which increases the absorption of some particular drug. Otherwise, overall general funda, food delays absorption. Food delays absorption. That's why most of the drugs, if absorption needs fast, it should be taken on empty stomach if you want a fast absorption. But the problem is that there are certain drugs, if taken empty stomach, they cause acidity. They cause acidity as an adverse effect. That's why we ask the patient to eat something and after that you take the drug. Otherwise, you will have acidity or, you know, gastritis. Gastritis is a common side effect of. That's why we ask the patient to take it. Food absorption will be slow. It's okay, but you don't have the side effect. So depending from situation to situation, we should analyze and take the judgment and answer our patient. Got my point? So presence of other food in the GIT delays absorption. Okay. Now the eighth factor, it is vascularity of the absorbing surface. You tell me what is the blood supply of GIT? Mesenteric blood vessels. So more is the blood supply, faster is the absorption. Here, can you see this is the blood vessel? Ultimately the drug present here or here in the stomach or intestine, it's going in the blood. Now imagine here blood is more or blood is less. If blood is more, absorption is faster. If blood is less, absorption is slower. So the rate of absorption is directly proportional to the blood flow. Directly proportional to blood flow. Let me give you an example over here. Let me draw a human body, a very good example. Have you ever thought, let me ask you a question first. First, you eat your food, breakfast or lunch or dinner. Okay, after food, how many of you, answer, how many of you feel sleepy? You feel drowsy, you feel sleepy. How many of you, including me feel? Whenever I take my food, breakfast, lunch, dinner, you know, I feel very drowsy for the next few minutes or hours. I feel very sleepy. Rather, sometimes I take a nap. How many of you? I will give you a reason for that, a scientific reason. Okay, it's not like ऐसे ही खाने के बाद आलसी आती है. People say, no, it's not like that. Everything have a Reason, everything is evidence based. We are studying evidence based medicine over here. Yes or no? Let me tell you, and let me correlate with the vascularity of the absorbing surface over here. So let me draw a human body, yours, mine, anyone. Suppose this is the human body, a rough structure of a human body I am drawing here. Let me show you the brain of this person over here, and let me show you the GIT of this person. Okay, like I'm just drawing a rough diagram, people, don't go on the anatomy and all. Okay, a rough diagram. Okay, now I want to show you the blood vessels of the brain. This is the blood vessel, and I want to show you the blood vessels of the GIT, the mesenteric blood vessels. These are the blood vessels of the GIT. Okay, now I am taking my lunch or dinner, a heavy dinner, chole kulche, chole puri, or some heavy dinner. Okay, some desserts, rasgulla, gulab jamun, something. Okay, so we are eating it. It's going in the mouth, it's going in the esophagus, it's going in the stomach and intestine. Okay, it contains high carbohydrate content. So total how much blood we have. I guess everyone know we have total 5 liter of blood. The adult human body have 5 liter of fluid total. Okay, now whenever abundant of food is present in the intestine, most of the blood out of the 5 liter is shunted in the intestine to get it absorbed. काम बढ़ गया ना intestine में. There is more work in the intestine to get absorbed. So out of the 5 liter, most of the blood is shunted in the intestine so that it can get absorbed. Okay. So here the food get absorbed. So out of the 5 liter, if most of the blood is shunted here the quantity of the blood is increased. Okay, so it is shunted from the brain. In the brain, the quantity of the blood is reduced after we eat, and that's why brain is getting less blood. That's why we feel drowsy. Okay, so before your exam, people, take some food which is light, which contain more fiber, less of carbohydrate, which is a filler, but absorption may carbohydrate content should be less, fat content should be less. That I will teach you tomorrow in nutrition in epidemiology, in PSM, in community medicine. Anyways, come back on pharmacology. This is the reason. This is the vascularity of the absorbing surface. How many of you got it? People, you can see these are the 9 factors which affect absorption. Out of the 9 factors which affect absorption, I completed 8 of them. The 8 factors are done. We will revise the 8 factor, and 9 factor is the real challenge. Let me tell you, the students who are attending the class right now, many of you watch the recording, I mean later on. So only 10% get it correctly. Let me see if you are among these 10% who can understand the 9th factor, that is effect of pH on absorption, or among the 90% who don't understand. Even I explain very nicely. So it's real challenge to understand the effect of pH on absorption of drug. I'm not scaring you, people. It's tricky. So you have to focus on your gadgets here. Okay, let's revise these 8 and finish them, pack them. They were very easy. What are these first 8 factors? Then we will come on the real challenge, the 9th one. The first factor is aqueous solubility. Aqueous solubility is directly proportional to rate of absorption. More tablet is more aqueous soluble, it will be faster absorbed. If it is less soluble, it will be less absorbed. Aqueous solubility, the first factor. The second is formulation. Apart from the active ingredient, okay, some inert ingredients are also there to make the formulation, okay, to make the tablet, to make the capsule, and that affects absorption. They can increase also, they can decrease also. To make the formulation, some inert substances are there. The third is concentration of drug, again directly proportional. More concentrated, fast absorbed, less concentrated, slow absorbed. So that is the third factor. Lipid solubility, directly proportional to rate of absorption. Okay, because the cell membranes are made up of lipid, and if we take a tablet via oral route, it has to cross multiple times the cell membrane. First the gastric mucosa, intestinal mucosa, then the endothelial cells of the blood. So the lipid soluble drug is more easily absorbed as compared to non-lipid soluble drug. The next is the surface area. That's why God has given us villi. More is the surface area, more is the absorption. Then motility of the drug, again directly proportional. That's concept of peristalsis. Okay, so more is the motility, more is the rate of absorption. Presence of other substances is inversely proportional to rate of absorption. If stomach already contain the food, the absorption is delayed. It is delayed. It's inversely proportional. It's inversely proportional to rate of absorption. Okay, vascularity is again directly proportional. Vascularity, more vascular, more blood supply, fast absorption. Less blood supply, slow absorption. How many of you got it? Can I come on the 9th factor, the last factor? How many of you are ready? Is it a shunting of blood to the intestine, or it is still in brain? People, how many of you are ready? Can I start the last one? The effect of pH on absorption of drug. What is the effect of ionization or effect of pH on absorption of drug? Can we start? Give me a thumbs up first, everyone. Give me a minute. I would like to have some sips of water. After that, I will start the effect of pH on the absorption of the drug. Quickly, we will come. Don't worry. Chalo. Can we start? What is the effect of absorption on the pH of the drug? Can I tell you? Now, first you understand how many type of drugs are there. There are two type of drugs. Electrolytes, non-electrolytes. How many of you read all these in your chemistry in your 9th standard? I have read all these in my 9th standard. It was in my syllabus. Okay, I guess in your syllabus also it was there. How many type of drugs are there, or how many types of chemicals are there? Drugs are chemicals. People, what are drugs? Drugs are actually chemicals that we have already read in chemistry subject in your school time when we were kids. Yes or no? So there are two type of chemicals, or there are two type of drugs: electrolytes and non-electrolytes. If the drug is non-electrolyte, drug can be electrolyte, drug can be non-electrolyte. Please understand, if the drug is non-electrolyte, it is not pH dependent. It is not pH dependent. It don't depend on pH. pH is acidic, pH is basic. Its absorption is not affected by pH because it is lipid soluble. Non-electrolytes are lipid soluble. They can cross the cell membrane. They can cross. I told you, no, they can cross the cell membrane. Okay. But if it is electrolyte, there are two type of electrolytes, strong and weak. Strong electrolytes are 100% ionized. Okay, weak electrolytes are partial ionized, and their ionization depends on pH. What is the pH? pH is acidic or pH is basic? I will explain. Please see the overview first. There are two type of weak electrolytes, weak acidic and weak basic. Now the problem is that most of the drugs are weak electrolytes. Most of the drugs, and their absorption depends on pH. Their absorption depends on pH. So same thing is written. So there are two type of drugs. Non-electrolyte, they are lipid soluble. But if they are electrolytes, they can be strong, they can be weak. How many of you got it? Listen, again the same diagram. You can see this is stomach and this is blood, mesenteric blood vessel. Okay, now this is the drug taken. This is the drug taken by mouth. It is going in mouth, it is going in esophagus, it is going in stomach, it is going in intestine. How it get absorbed? How we want it to reach to the blood. But it is not via magic it is reaching to the blood. How? It has to cross something. Now, what exactly it's crossing? It is crossing the cell membrane, the mucosal membrane of the stomach and the endothelial cell lining of the blood vessel to reach the lumen of the blood. It has to cross two cells. First, it will cross this cell, go here. Then it will cross this cell, go here. And then it will come in the lumen. This is how it happens. So it has to cross this cell membrane and this cell membrane to come, and these linings also, to come on the lumen, in the lumen of the stomach. Now this is made up of lipid, as I told you. Okay, so if the drug is non-electrolyte, it can cross because it is lipid soluble. Non-electrolytes are lipid soluble. That's the point. The non-electrolyte drugs are lipid soluble. They are lipid soluble. They are lipid only. They can dissolve in the cell membrane and cross it. They can dissolve the cell membrane and cross it and reach it here. But what if the drug is electrolyte, weak electrolyte? It is not lipid soluble. It is not lipid soluble. Then how it can cross it? It is not the thing that non-lipid soluble drugs or electrolyte drugs will not cross. They will also cross. But the factor is different. Here it is pH dependent. How many of you got it? So most of the drugs are weak electrolytes and their ionization is pH dependent. You know, there are two type of drugs. I told you, weak acids and weak base. Weak acid and weak base. I mean weak electrolytes. If most of the drugs are weak electrolyte, they are not lipid soluble. They are weak electrolytes. Okay, and they are of two type. Weak acid, please understand, it's chemistry, pure chemistry, and weak base. Weak acid and weak base. What is the acid? Chemistry, people 8th standard, 9th standard mein padhate hain. Acid. Acid is a substance which is having a proton in that. For example, HCl, for example, HNO3, for example, H2SO4. They all contain a proton, proton, proton. Anything which is having a proton is an acid. So it is having a proton and some other element. Okay, for example, H, this can be Cl. For example, H, this can be NO3. For example, H, this can be SO4, like that. So acid. So the formula for acid for me is HA. H is proton. A can be anything. A can be H ka Cl, SO4, NO3, like that. है ना? So it is HA. What is a base? Define a base. People, chemistry 8th standard, come on. Shall I ask the kids this question? Huh? What is a base? Say, ma'am, anything which is having a hydroxyl ion, like NaOH, like KOH, like CaOH2, like that. So anything which is having a hydroxyl ion is a base. Yes or no? Common sense, basic knowledge. So if I say the formula, the basic formula for base is BOH. Okay, BOH. So here OH is hydroxyl ion. B can be sodium, potassium, calcium, phosphorus. It can be anything. It can be any element. So this is the base. So for me, the formula of acid is HA, in which H is proton. and A can be anything. H is proton and A can be. So this is weak acid and weak base. So whenever I say acid, I will write it HA. Whenever I say base, I will write BOH. How many of you got it? You will get all these things in your books. You will get what is this HA, what is this BOH, ये कौन सा acid है, ये कौन सा base है. So this is a formula. The basic formula, acid is shown like this and base is shown like this. How many of you got it? So this is a formula for acid, HA. This is a formula for base, BOH. So both of them are getting ionized. Okay, this side I will take acid, weak acid. This side I will take base, weak base. Okay, what is the formula of acid? HA. How it will get ionized? H positive and A negative, like HCl. So H positive, Cl negative, like HNO3. So H positive, NO3 negative, like that. Okay, so one cation, one anion is formed. You know what is cation and anion at least, huh? What is the base? Base is BOH. How does it get ionized? So B positive and OH negative, like NaOH. Na positive, OH negative, like KOH. K positive, OH negative, like this. Now, you are getting my point. Please, people, you say, ki, ma'am, is it pharmacology class or chemistry class? Someone should ask this. Ki, ma'am, what you are teaching us? I thought it's a pharmacology class, but I think you are teaching us chemistry. No. It's not chemistry. It's your pharmacology only. These are drugs. Drugs are acidic and basic in nature. Some drugs are acidic in nature. Some drugs are basic in nature. So this is their formula. Please understand. Okay. So where is my drug? My drug is A or B. Okay. Proton and hydroxyl ion is not my drug. My basic drug is A or B. If it is acidic drug, the drug is A. If it is basic drug, the drug is B. Here it is with proton and here it is with hydroxyl ion. My basic drug is A or B. My basic drug is A or B. You are getting my point, what I am saying. Now listen. Where is the drug? Here. Kahan par hai drug? Drug A is present at two places. Where is the drug B here? B is present at two places. What are the two places? Drug A is present here and here. Drug B is present here and here. Okay, so drug is present in two forms. This is known as unionized form. I will call it UI. Unionized. It is not ionized, it's complete. It's unionized. And this one is an ion. It's an ion. It is having a charge on that. You can see. So this is ionized. Please understand, I am explaining you from very basic. Again, this is unionized. This is ionized. How many of you got it? Huh? So drugs have two forms. The acidic and basic drugs have two forms. Acidic drugs and basic drugs have two forms. They can be unionized, they can be ionized. Now learn the golden rule given by the God. You can't change, me can't change. Learn the golden rule. What does the golden rule says? Golden rule says body loves unionized drug. Body don't like ions. Body don't like charges. Human body don't like charges. So unionized drug get absorbed by the body. And ionized get excreted by the body. Whatever, is it acid or base? Unionized is absorbed from the body and ionized get excreted from the body. Body don't like ions to retain. Body ko ions pasand hai. Body don't like charges to retain. Body will excrete it. But if it is unionized without charge, body will absorb it and keep it. So it's a golden rule given by the God. People, you can't change it. Whether it's acidic drug or basic drug, the rule says unionized is absorbed and ionized get excreted. How many of you got it? So same story is written. Whatever I have explained you, please keep responding. At least give some emoji if you can't write in the comment box. Give some hearts, give some thumbs up. At least give a gesture that you are getting it. Come on. Am I live? Sometimes I wonder if I'm live. Come on. Such a boring audience. Say. Okay. I guess you got it. Chalo. So you can see the two type of drugs. You can see acidic drug, basic drug. How they are getting ionized? You can see acidic drug and basic drug, they are ionized. So what is the rule? Where is the ionized form and where is the unionized form? Say, this is unionized form and this is ionized form. What is the rule? Body don't like ions. So ionized form is excreted and body loves the complete form without charges. So unionized form is absorbed. Okay, now have you read chemistry again, 9th standard or 8th standard? You know the formula of pH. What is the formula of pH? pH is equal to pKa plus logarithm of ionized upon unionized. Okay, again, this is for acidic drug. pH is equal to pKa plus logarithm of ionized upon unionized. Upper ionized hai, the numerator is ionized. The denominator is unionized. The numerator is ionized. So what is the formula of pH? Who will tell me the formula of pH? pH is equal to pKa. pH is equal to pKa plus logarithm of what and what? What is the numerator? What is the denominator? Numerator is ionized form and denominator is unionized form. You have to mug this formula. I have not created this formula, so don't look at me like this. It's a chemistry. It's a known formula. You have read this in the chemistry. Now I will apply this formula for the drugs. Okay. So this is the formula. This is the formula for acidic drugs or basic drugs. How many of you got it? The numerator is ionized and the denominator is unionized. You have to learn. So logarithm of numerator and denominator. Numerator, denominator matters. So here the numerator is having ionized form and denominator is having unionized form. If it is acidic drug, so ionized form is A negative and unionized is Ha. H positive, A negative. If it is a base, it is B positive and OH negative. I mean BOH. BOH. It is like this. I hope you all are getting it. Now, first of all, in this formula, you tell me what is pK. What is pK? You know, neutral temperature, neutral pH. Neutral pH is 7. For the water, it's 7. Okay, now, if you know the basic rule, if you increase the pH from 7, say you increase it, 8, 9, 10, 11, it become basic. The thing become basic. Okay, it is neutral. And you know, if you reduce the pH of water, like 6, 5, 4, 3, 2, 1, if you're reducing it, it become acidic. I guess these are the basic things everyone know. Ye to nahi padhana hai na. So here we are increasing. The rule is that if you increase the pH by 1 unit, by 2 unit, by 3 unit, by 4 unit, it's going on basic in nature. The basicity is increasing. Alkalinity is increasing. And if you are reducing the pH, by 1 unit, 2 unit, 3 unit, 4 unit, it keep on acidic. So the rule is that the pH, if you increase the pH, the thing become basic. If you decrease the pH, the thing become acidic. You are increasing it or decreasing it by 1 unit, 2 unit, 3 unit from the neutral. I guess this is the again basic rule everyone know. Okay, now come on. In the formula, my next question, what is pK? pH is equal to pKa. Nobody of you asked me, ma'am, what is this pKa? pKa plus logarithm of ionized form upon unionized form. Who will tell me what is pK? Wait. Yeah, I said constant. I know, Uttam, but define this constant. Uttam, you would like to define? Yeah? Say, what is pK? I'm asking you pK. To define pK, it's a very easy thing. Listen. Suppose let's take example of acid. I will take one example, either acid or base. You take. Whatever we will take, we will do opposite in the other. Acid le lo, ki base le lo. I will take one and explain everything according to that. Let's take acid. So acid is Ha. I will not take two things again and again. Ha. Ha will split like H positive and A negative. Okay, this is the thing. Okay, now this is unionized form. This is ionized form. Okay, suppose I have taken a tablet, which is this acid, by a mouth. Okay, suppose this is a tablet I don't have, but imagine it's a tablet in my hand. I'm keeping in my mouth. Okay, this is this form, unionized form. I will take in unionized form, obviously. I'm taking in unionized form. I'm taking it with water. It's going inside me. In my stomach or in my intestine, it gets split. Based on the pH, it get ionized. So how much is getting split? 50% is as it is, suppose, and 50% get ionized. Okay, not this. This is the proton. Okay, I mean this form. This is ionized form. Okay, 50% get ionized. Okay, suppose whatever I am taking, 50% after going is as it is and 50% get ionized in my stomach. In my intestine. 50% remains as it is. It don't split. It don't disintegrate. It don't ionize. And 50% is ionized and converted into ion. Suppose. So what is the ionized form? Say, ma'am, 50%. What is the unionized form? Say 50%. They will cancel? Yes, obviously they will cancel. Ionized, unionized cancel. So here it will be 1. What is log 1? People common sense. बच्चों से पूछूं क्या? Huh? The kids will answer. What is log 1? Log 1 is 0. So log 1 is 0. So pH is equal to pK. Okay, so can I say pKa? What is the definition of pKa now? You tell me. pKa is the pH at which ionized and unionized form both are 50-50%. It's a very important MCQ. Students used to learn it. Mug it. I don't know why. So what is pKa? Who will tell me what is pK? pKa is the pH. It's the pH at which ionized and unionized form are equal. Both of them are 50%. That's why they cancel each out. Okay, so log 1 will become 0 and they become equal. Say people say, got it, same story is written. Now read book, it will become cakewalk for you. If you read the book before my session, I think it was a bouncer. But now you read it, it will be a cakewalk. And rather, I will say there is no need to read book. Everything, more than 100% is covered here. Okay, you see the again acid ka example is taken. You see the formula. You see both of them are equal. Ionized and unionized. Both are 50-50%. So they cancel each out. It becomes 1. And log 1 is 0. So pH is equal to pK. So what is the definition of pKa? What is pKa? pKa is pH at which drug is 50% ionized and 50% unionized. You say both. 50% ionized, 50% unionized. So ionized is equal to unionized. At that pH, pK is equal to pH. So same story is written. Now come the real challenge. I will try. I will try once. No, I will try twice. Okay, let's see. But if you are getting it. Okay, listen. Now comes the real challenge. If I wish, I can tell you the summary. Bhaiya, this is the summary. Most of the, at the platforms that they tell the summary. Ye learn kar lo. You have to learn. It's a golden rule. But I am telling you the derivation. You know how to derive the things. In mathematics, everything is evidence based. Na? So here I will derive this conclusion. I will not ask you to mug it up. We will mug it up in the end, but with the derivation. Here I will derive it for you. We will do the mathematical derivation. So we will come on mathematics now. Huh? So can we come? Chalo. This side we are taking the acid. You see how ionization takes place? This side we are taking the base. Let's do it for acid only. Basically, everything will be reversed. Okay, let's do it for the acid only. This side acid, this side base. Okay, see the formula of pH. Formula of pH is not going to change. Let's take 3 conditions. Let's take neutral. Let's take a condition when ionized is equal to unionized. Okay, 50-50%. Both are 50-50%. Let's take a condition when ionized is more than unionized. And let's take a condition when unionized is more than ionized. Let's take 3 conditions, apply in the formula. Common sense, apply in the formula. Now, in this condition, when both are equal, we have already seen they cancel each out. Log 1 is equal to 0 and pH is equal to pK. pH is equal to pK. Say yes or no. pH become pK. This condition we have already done. This side we have already done. Okay. Now, if ionized is more than unionized. See. Ionized is 10 times more than. For example, we have to take some figure. Ionized is more than unionized, मान लिया, okay, but it is 10 times more. How much? 10 times. And here unionized is more than ionized, 10 times more. Let's take a figure, 10. You can take 100, you can take 1000. For the sake of understanding, let's take 10. Now apply the formula. Apply this condition over here. Apply. Okay, so I'm saying pH is equal to pKa logarithm of ionized is 10 times more. This is 10 as compared to unionized. Ionized is 10 times more than ionized. So log 10. Log 10 upon 1. Log 10 is 1. You know, log 1 is 0. Dekho, log 1 is equal to 0. Ye pata hai? You know that. If you don't know, learn it. You know, log 1 is 0. Okay. Log 10 is equal to 1. That is 10 to the power 1. Okay. And log 1 by 10 is equal to minus 1. Okay. Because 1 by 10 is equivalent to 10 power minus 1. Okay. So it will be power. I guess I'm not teaching you mathematics. Come on. I guess you know these rules. Okay. So what's going to happen here? You apply this. You keep ionized 10 times more than unionized. Karo. So here this is 10 and this is 1. So log 10 by 1 is 1. So in this case, pH is equal to pKa plus 1. Similarly, this side if we are applying, unionized is 10 times more than ionized. So it will be 1 upon 10. So it will be log 1 upon 10. That will be minus 1. So pH is equal to pKa minus 1. Okay, pH is equal to pK. I tried, people, from the depth of my heart. I don't know whether you got it or not. But here pH is equal to pK. Here pH is equal to pK plus 1. And here pH is equal to pK minus 1. I told you basic rule, neutral temperature. If you increase the pH, it becomes basic. And if you decrease the pH, it becomes acidic. I guess everyone knows that, the basic rule. Now here by adding, you are increasing the pH. You are increasing. So here the medium is basic. You are doing it basic medium. Okay. And here by reducing the pH is equal to pK minus 1. You are doing the medium acidic, and this one is neutral. Okay. So at neutral, it is 50-50%. But at basic medium, ionized form is more. And at acidic medium, unionized is more. It can be 10 times, 100 times, 1000 times. For the sake of understanding, we took 10. How many of you got it? So in basic medium, ionized form is more. And in acidic medium, unionized is more. 10 times, 100 times. But ionized get excreted. So we are talking about acidic drug. This was an acidic drug. Don't forget that. Acidic drug get excreted at basic medium. And acidic drug get absorbed at acidic medium. Okay. So this is the summary. This is what it is written. Okay, but how I had derived it, it's in front of you. How I derived it, it's in front of you. Okay, how many of you got it? Shall I do it for the basic also, or you got it? You will do everything reverse there. Huh? Everything reverse there. So the summary is that people, focus. I'm telling you the summary. You got the derivation, very good. Done, 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 done. If you didn't got it, double good. Learn the summary. Learn the summary. Ultimately, nobody is going to ask you derive. Okay, it's not a, mathematics exam ki derive everything. You have to learn the summary and solve the MCQs. But if you have learned how it is derived, you will not forget it. You are getting my point. Listen, dekho, everyone here, each and everyone, please, if you are feeling sleepy, drowsy, wake up, wash your face, have a cup of coffee and focus here. Listen, what I'm saying. For absorption and for excretion. Talk about absorption, talk about excretion. I'm not interested in distribution and metabolism. There are four parts in pharmacokinetics. First absorption, then distribution, then metabolism, then excretion. But currently I am not interested in distribution and metabolism, so erase them. Okay, let's erase them. Erase it. To what I am interested? I am interested in absorption and excretion. Okay, listen. Absorption ki learn the golden rule. For absorption, same pH is required. For excretion, opposite pH is required. Listen. We will take two drugs one by one. Suppose this is my diagram, my internal organs diagram. Okay, I am taking an acidic drug, weak acidic. Whenever I say acidic basic, I mean weak acidic and weak basic. Strong acid and base, they are 100% ionized. Okay, so if I say acidic drug, I mean weak acid, common sense again. So if I'm taking an acidic drug, suppose I'm having a tablet in my hand. Now depends, this drug is acidic or basic. You have to learn the list. Okay, some drugs are acidic in nature, some are basic in nature. So by chemical composition, is it a weak acid or a weak base? Okay, suppose I'm taking it, it's acid. For example, it's an acid. Okay, so it will go inside. For absorption, there are two possibilities. Absorption can happen in stomach or intestine. There are two options, two organs. So which drug get absorbed from where? What is the rule? For absorption, same pH is required. So acidic drugs get absorbed from acidic medium and basic drug get absorbed from basic medium. You're getting my point. If I'm taking acidic drug, it will absorb from stomach. If I take a basic drug, instead of acidic, if this tablet is basic in nature, whatever I am taking with sips of water, suppose I'm taking a tablet with sips of water, it's going inside. Okay, so if it is basic in nature, it will get absorbed from intestine. I guess everyone know, ye to pata hai na boss, ki stomach have acidic medium and intestine have basic medium. Everyone knows that. Stomach is having acid, HCl, which is secreted by the parietal cell, which is synthesized by parietal cell. And intestine have basic medium. Yes or no? Because of the pancreatic secretions and all, it is having basic medium. So suppose I'm having a tablet, I'm taking it. I'm keeping in my tongue, mouth. I'm taking sips of water. It's in mouth. It's going in my esophagus. It will go in my stomach as well as intestine. Now, from where it will be absorbed? It will absorb from stomach or from intestine. From where it will be absorbed? Depends the nature. If it is acidic, it will absorb from stomach. If it is basic, it will absorb from the intestine. Because acidic absorb from acidic, basic absorb from basic. For absorption, same medium is required. How many of you got it? Give me a thumbs up. For absorption, same medium is required. Same pH is required. Acidic absorb from acidic and basic absorb from basic. For absorption, same medium is required. That means acidic drug get absorbed from acidic medium, that is stomach, and basic drug get absorbed from basic medium, that is intestine. That is regarding the absorption. Now drug is absorbed via acidic or basic, it is reached the stomach, it is reached the circulation. If it is acidic, via stomach. If it is basic, via intestine, but it reached the circulation. It will go to site of action, show its mechanism of action. It will go to liver, get convert from non-polar to polar. I'm not interested in this. I'm not interested in this. Now time for excretion. I'm interested in excretion now. I'm not interested in distribution. I'm not interested in metabolism. Okay. I'm interested in excretion. Just a second. There was some sound on from my AC. Let me switch off my AC. Give me a minute, people. I got scared. I'm sorry. I guess some short circuit. Okay. Okay, it's fixed. I'm sorry. Chalo. What about excretion? Come back. For absorption, God has given two organs. For absorption, God has given two organs. I mean, stomach and intestine. Yes or no? Acidic get absorbed from stomach and basic get absorbed from the intestine. What about excretion? What about excretion? For excretion, God has given only one organ, kidney. But we don't have, boss, we don't have two organs. One for acidic drugs, one for basic drug. For excretion, only one organ is there, kidney. Okay, but in the kidney, urine is formed, na? In the kidney, urine is formed. Drug get excreted via urine. They get out via urine. Urine can have two different pH. Urine can have two different pH. For excretion, opposite pH is required. So if it is an acidic drug which is coming to the kidney and asking kidney, will you excrete me? Kidney say, yes, I will excrete you. For excreting you, I have to make the urine basic. Then only you will get excreted. If a basic drug is asking and coming and asking kidney, will you excrete me? Kidney say, yes, I will excrete you. But for excreting you, I have to make the urine acidic. So for excretion, opposite medium is required. How many of you got it? Huh? How many of you got it? Say. Say, people say. How many of you got it? Huh? So for absorption, same medium is required. For excretion, opposite medium is required. This is the summary. This is the summary. For absorption, God has given us two organs, stomach and intestine. Some drugs get absorbed from stomach, some from intestine, depending the nature of the drug. Acidic drug absorbed from acidic medium, that is stomach, and basic drug absorbed from basic medium, that is intestine. But for excretion, God has given only one organ, kidney. In the kidney, urine is formed, but urine can have two different pH, acidic and basic. Urine can be acidic, urine can be basic. Okay. Now, if a acidic drug has to be excreted, the urine has to be basic. And if a basic drug has to be excreted, the urine should be acidic. This is the golden rule. People, and I have derived in front of you. This derivation is done in front of you if you have understood it. The same will be done for the basic drug. So this is the golden rule you have to learn. So what is the implication of this rule? I've already explained you the implication. You can see the absorption and excretion. Absorption, acidic drug absorbed from acidic medium. Okay, that is stomach. Basic drug absorbed from the basic medium, that is intestine. Acidic drug, I will give you the list. Aspirin, for example, aspirin is an acidic drug. Atropine is a basic drug. So acidic drugs absorbed from stomach, basic drugs absorbed from intestine. I will not repeat again and again. Acidic from acidic, basic from basic, two different organs. So this is the absorption. Now what about excretion? For excretion, opposite. Acidic drugs are excreted if the urine is basic, and basic drugs are excreted if the urine is acidic. So here, okay, here there are two type of drugs. For example, there is an acidic drug in the blood and basic drug in the blood. Okay, acidic drug is asking kidney, will you excrete me? Kidney say, yes, I will excrete you. But for excreting you, I have to make the urine basic. But yeah, I will excrete you. Don't worry, come, I will make the urine excrete and get you excreted. Basic drug is coming. Kidney, will you excrete me? Kidney say, yes, I will also excrete you. For excreting you, I have to make the urine acidic. But don't worry, you come, I will acidify the urine and get you excreted. So for excreting the acidic and basic drug, opposite medium is required. So same thing is written. Got my point? You are getting my point. Now let me ask you a question, people. Let me ask you a question. The same thing is given in front of you. You can see here, we are changing the medium. We are making it acidic and basic twice. You can see from 3 to 8, from 3 to 8. So this is acidic, and here, let's take acidic drug. So acidic drugs are absorbed. You know, ionized form and unionized form. Ionized form is excreted. Body don't keep ions, body excrete them. And unionized form get absorbed. Body retain the unionized form. Okay. So you know when the pH is 3, so acidic drug is 99% unionized and get absorbed. Only 1% is excreted. When the pH is 8, you know 99% is ionized. That is excreted. Only 1% is absorbed. You are getting my point. You are getting my point. Same reverse occur with the basic drug. Please understand. Listen. Acidic drug, HA. It will get ionized like H positive and A negative. Okay, now let's take two different pH. Let's take pH 3 and let's take pH 8. Let's take pH as 3 and let's take pH as 8. I mean, this is acidic pH and this is basic pH. Same equation occur in both. But what about the percentage? Tell me percentage of unionized form and ionized form on these pH. Okay, so when the pH is acidic, when the pH is, this is acidic drug. We are talking about all this as acidic drug. Okay. When the pH is acidic, absorption is more. So 99% is unionized. Only 1% will get ion. Okay. So this will get absorbed. This will get excreted. Okay. But when the pH become basic, reverse happen. Only 1% get unionized. 99% get ionized. The equation don't change. The percentage are changing. And you know the golden rule. Golden rule, unionized form, body absorb it. And that's why in acidic medium, acidic drug get absorbed. Okay, and in basic medium, acidic drug get excreted. How many of you got it, people? I tried. Yes, got it. Yes or no? So this is the thing. Now I want to ask you a question. Open your ears, open your brain, and please listen my question and try to answer it. Okay, without getting biased. Please answer me. You are doctor. This is your patient. The diagram in front of you. This is your patient system. The patient is coming to you. Okay, for blah 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 disease, some disease, XYZ disease. Okay, for that disease, you are doing some investigation, making your diagnosis, and prescribing a drug to the patient. You are prescribing a drug to the patient. Take this drug, you will be all right. Okay, this is the drug patient is taking. This is the drug. Now, my question to you, you want this drug to get absorbed or get excreted? You want this drug to get absorbed or get excreted for your patient? You want this drug to get absorbed or excreted from the body of your patient? I want to ask you, absorption more you want or excretion more you want? It depends from situation to situation. Khalil, you are saying absorption. What about others? Others are sleeping. Everyone answer. You want absorption or excretion? Most of the students are saying absorption. Okay, now it depends on situation to situation. Let me tell you another scenario. Okay, this was the first scenario. Patient is coming to you and patient with some disease. You are giving a drug. You want first absorption and then you want excretion. First you want absorption. Drug should show its action and then. Imagine a reverse situation. Okay, you are in emergency OPD. Okay, and on a stretcher, a patient is brought to you in emergency OPD with the mother or with the relatives, and mother or relatives are showing you empty strip. My boy, my son tried to commit the suicide. He has taken 100 sleeping pills together, and this is the empty strip of that sleeping pill. And he has taken 100 of it. He tried to commit suicide. Doctor, still he's alive. Try to save him. He's unconscious, but he's alive. Imagine a mother or a family is taking a teenage boy to you in emergency OPD. The boy is unconscious, but still it is live. The person is not dead. The patient is not dead. In that case, the person have already taken 100 tablets of any tranquilizer or sleeping pill. In that case, you want absorption more or excretion more? In such situation, you want absorption more or excretion more? My question is still same. You want, being a doctor, what do you want? Being a doctor, you want absorption more or excretion more? In such situation, we want to save the patient. Patient have already taken 100 pills. We don't want to get absorbed. Person will die. We want excretion more. Whatever it is already absorbed, we want excretion more. In that situation, we want excretion. So you can't say absorption. You can't say excretion. It depends from situation to situation. It depends from situation to situation. If you want absorption more, so whatever is your drug can be acidic, your drug can be basic. Okay. It will get automatically absorbed from stomach or intestine. You don't have to do anything. Okay. Stomach have acidic medium and intestine have basic medium. God has given two different organ. Bhai organ hi alag hai. Boss is a separate organ. Stomach is a separate organ. Intestine is a separate organ. The God is great. God has given two different organs. If it is acidic drug, automatically it get absorbed from stomach. If it is a basic drug, automatically it will get absorbed from the intestine. Okay, being a doctor, you don't have to think, bhaiya, it is an acidic drug. I have to give acid together for getting absorbed. No, no, no. Stomach already have the acid, it will get absorbed. If it is a basic drug, I have to give a base along with the drug so that it absorbs. No, intestine already have the base. It will get absorbed. For absorption, you don't have to worry. But in case of poison, this patient is poison or suicide patient. Okay, this patient is suicide patient. He has already taken over concentration of the drug, 100 sleeping pills. Okay, now whenever such situation come in your career, whenever there is a suicide patient who has taken abundant overdose of the drug, okay, suicide, homicide, or whatever, and the first thing you have to ask, show me the empty strip. Now the family or the relatives will show you the empty strip. Looking at the composition of that drug, you should know instantly, is it acidic or basic? Because you want to excrete it. Now you want excretion. Now you want excretion from the body. But for excretion, God has given, unfortunately, one organ. We don't have two separate organs, kidney 1, kidney 2. Kidney 1 is for acidic drug, kidney 2. We have only one organ. We have two kidneys although, but both excrete like same. Okay. But the urine ka pH can be changed. Okay. So if I am doctor at duty and there is a patient on the stretcher whose mother is crying and saying, doctor, save my son, he tried to commit suicide, and she's showing me the empty strip. The empty strip is an acidic drug. For example, patient has taken 100 sleeping pills which are acidic in nature. Okay, acidic in nature. I want to excrete them. So quickly I will make the urine basic. I will basify. I will alkalinize the urine of this person by starting the drip. If the patient is conscious oral or otherwise we will start the drip, we can alkalinize the urine so that it get excrete. Or if the empty strip, the composition is of a basic drug. Person have taken 100 basic drugs together to get suicide. Okay, quickly I will acidify the urine. Being a doctor on duty, I will quickly acidify the urine so that it can excrete it. Okay, so this knowledge is very important. At the point whenever they are showing you the drug, the composition, you cannot Google is it acidic or basic. Some emergency drugs, you know, most commonly used suicide drugs, you should know is it acidic or basic. In that case, you have to acidify urine or basify urine. If you do opposite, person will die. Okay, so this is emergency duty. You are getting my point. Same thing is written. You have to alkalinize the urine. Okay, and you have to acidify the urine. I mean, you can base. So you will ask him, ma'am, can we change the pH of the urine? Yes, you can change the pH of the urine. You can make the urine basic in nature. You can make the urine acidic in nature by doing so. If you want to make the urine basic, start the drip of IV sodium bicarbonate. Start the drip. Patient is unconscious, now you start the drip. Urine automatically become basic. If you want to acidify the urine, start the drip of arginine hydrochloride followed by ammonium chloride. Arginine hydrochloride followed by ammonium chloride. If you want to acidify the urine. Okay, you are getting my point. So I am having a poisoning case or suicide case. Poisoning case or suicide case who have taken 100 tablets together and tried to commit suicide. I want the excretion of the drug. Okay, now it depends. Drug is acidic or drug is basic. If drug is acidic, I will basify the urine. I mean, I will alkalinize the urine. Alkalinize or basify the urine. If drug is basic, I will acidify the urine. I will acidify the urine. So you can alkalinize the urine or acidify the urine. For basifying the urine, start the drip of sodium bicarbonate. Sodium bicarbonate. And here start the drip of arginine hydrochloride followed by ammonium hydrochloride. Okay, this is how you can basify the urine and acidify the urine. I tried, people. I tried very hard. So what is the summary? What is the summary? Huh? If you don't know what is taken, so in that case, don't use this formula on the guess. Opposite happen, person will die. Then use other methods. Now, you try if the person is conscious, ask to vomit so that if unabsorbed form, or you go for hemodialysis. I will come on hemodialysis portion tomorrow, which drugs are to be hemodialyzed. In that case, try other forms. But you try this form only if you know the composition of the drug which is taken in case of poisoning. How many of you got it? Everyone got it? Say yes, no, but respond. People respond. Please respond. So this is the summary. What we have learned. Today I taught you a complicated topic. I taught you the effect of pH on absorption of drug and excretion of drug. For absorption, I told you same medium is required. I mean acidic drug absorbed in acidic medium, basic drug absorbed in basic medium. For excretion, opposite medium is required. I mean acidic drugs are excreted in basic medium and basic drugs are excreted in acidic medium. This is what I taught you with proper derivations. I have not asked you to learn the golden rule. I have derived each and everything and told you this. How many of you got it? How many of you got it? Huh? So, okay. So can we write it? Huh? Acidic drug summary. I don't like this passive reading. I like to write down asking you. Okay, use your brain again and again. Okay, think again and again. Write again and again. Acidic drug, basic drug. Okay. Acidic drug, basic drug. You want absorption. You want excretion. You want absorption. You want excretion. The rule is that for absorption, same medium is required. Okay, same medium is required. For excretion, opposite medium is required. For excretion, opposite. Learn this golden rule. So if it is acidic drug, it will absorb in acidic medium. Okay, and if it is acidic drug, it will excrete it in basic. For absorption, acidic is required. Acidic get absorbed in acidic. Acidic get excreted in basic. Okay, similarly, if it is a basic drug, it get absorbed in basic and it get excreted in acidic. So basic drug absorbed in basic and excreted in acidic. How many of you got it? Wait. You know absorption and excretion. Instead of absorption, iske badle, can I write unionized form? Because body love unionized and it retain it. And instead of excretion, can I write ionized form? Yes. Please use your common sense. I told you. Body retain the unionized form. That is body absorb it. And body excrete the ionized form. Okay, body don't like ions. So can I say instead of this, in other words, let's try to say it. The same thing in other words. So can I say acidic drug unionized form get absorbed and acidic drug ionized form get excreted? basic drug, anionized form, acidic drug, anionized form get absorbed at acidic medium, okay, and ionized form get excreted at basic medium. Same with basic drug. So you have to use all these terminologies. This is the summary. The same thing is written in front of you. If I read it passively, you don't get it, but I think you are getting it now. Yes. So you can see the ionized form, okay, for acidic drug. Acidic drug are absorbed in acidic medium and excreted in basic medium. But you have to say in terms of ionized and anionized form. Same, basic drugs are absorbed in basic and excreted in acidic. But you have to say in terms of ionized and anionized. You want to say me again or everyone got it? You want to say me again or everyone got it? If everyone got it, everyone will answer. Each and every one of you who is live right now, please answer. I'm having questions for you. You have to write down your answer in the comment box within 15 seconds. So be fast and be accurate. The two things required to crack any competitive exam. Okay, your speed and your accuracy. Both should balance. Chalo. The first question is in front of you. Read the first question. Read the first question. Let me read it for you. Okay, acetyl salicylate and phenobarbitone. Both of them are absorbed better from stomach. Why? It is given to you. They are not asking. It is absorbed better from stomach. But why they are absorbed better from stomach, not from intestine? Why? Why? First, you decide these two drugs are weak acid or strong acid. Strong acid doesn't depend on pH. So strong acid option is out. Okay, now you decide. Now you decide, are they weak acids? These two options have weak acid or weak base. Are they weak acid or weak base? Since they are absorbing from stomach, stomach have acidic medium. Stomach have acidic medium. And for absorption, they are asking about absorption, not excretion. They are asking. For absorption, same medium is required. So these drugs are acid. So this option is gone. This is how you have to exclude it. Now we are left with two options. Weak acid, weak acid. Is it their ionized form or unionized form in the acidic medium? In the acidic medium, they are absorbed. Body retain unionized form. So option A is correct. Ionized form is not absorbed, it is excreted. So this is how you have to approach it. Yes, everyone is right and I am very happy you all are right. Who's first to answer? Hari Bhaskar, you are first to answer. Yes, everyone is right. Rest everyone. The correct answer is A. This is how you have to approach it. People, approach is important. I'm not interested in answer. I'm interested in approach. Your approach should be correct. Okay. So same reason is given to you. Okay, Ji. The next question, I guess it's a easy, chilly, pilly, very easy question. Acidic drug is more ionized at. Acidic drug. Instead of ionized form are absorbed or excreted. Body want ionized form or do not want ionized form? Body don't like ions. Body don't like charges. So body excrete it. Okay. So acidic drugs are excreted. Read it like this. Instead of ionized form, read it excreted. Acidic drugs are excreted. So excretion ke liye we need opposite medium. So acidic drugs are excreted at alkaline medium. Again, the answer is A. Yes, I cannot see who is first because the answer is A again. Yes, but you all are right. Very good. So it's alkaline medium. If I change the question, instead of acidic, if I do basic, so answer become acidic pH. So you have to be very conceptual. You can't mug it up all these things. Come on. If you understand, you are right. If you don't understand, you know, here bluffing is not allowed. I mean, you won't be able to bluff here. Chalo, the next question. What is the best way to manage a patient of aspirin poisoning? Patient have taken 100 tablets of aspirin to do suicide. It's a poisoning case. Come on. You want to save the patient? So first you tell me aspirin is the acidic drug or basic drug. Aspirin is the acidic. Okay. For your knowledge, let me tell you aspirin is the acidic drug if you don't know. But you should learn it. I've given you the example. Na? Aspirin is the acidic drug. Atropine is a basic drug. Huh? So aspirin is the acidic drug. So patient have taken 100 tablets of acidic drug. You want to save the person. You want absorption more or excretion? No, it's poisoning. We don't want more absorption. We want excretion. So basically you want excretion of acidic drug. And for excretion, opposite pH is required. For acidic, you need to basify the urine. How to basify the urine? By giving a drip of sodium bicarbonate. Make the urine alkaline. So correct answer here is B. If I change the question from aspirin to atropine, would you like to change your answer? You should. Huh? So what is atropine? Atropine is a basic drug. Everything will reverse. You want to excrete basic drug. It's a poisoning case. You want to excrete basic drug. So you want to excrete, excretion ke liye opposite medium is required. In that case, I'm really sorry. In that case, you need acidify to the urine and that will be done with the help of argon and hydrochloride followed by ammonium chloride. The next question is in front of you. Please read it. Alkalinization of urine is done for which drug? We want to excrete which drug? Urine may we do excretion, not absorption. So if you want to excrete which drug, you want to alkaline the urine. Opposite medium for acidic drug, not for basic, not for basic. We want to excrete acidic drug. So is it strong acid or weak? It's always weak. Strong acid are not pH dependent. So again, the correct answer is A. I hope you got it. I hope you got it. Yes or no? Say, people, say. Yes or no? So I'm ending the session here, today's session. Okay, just a second. Let me announce my tomorrow's session before you people go. Give me just 1 minute. So I hope you got it. Today we have started absorption, but we couldn't finish it yet. Okay, absorption is still pending. Okay, just a second. Okay, but I will continue it tomorrow. So tomorrow is also, we are having the free demo session of pharmacology. Tomorrow, 19th of November, Wednesday, tomorrow. Don't you dare to miss my session. It's again 7:30 p.m. It will be for 2 hours, 7:30 to approx 9:30. The same 2 hours, you have to come live. The only thing, instead of YouTube, today it's on YouTube. Instead of YouTube, it is on my app. It's on our app. What is our app? Our app is MedLive by Dr. Priyanka. Search it on the Google Play Store. You will get it. If you don't want to search after the session, in this session only, the comment box, the link to download this app will be pinned. Okay, and you can download, if you are watching a recording later on, you can easily download it from the comment section. The link to download this app is pinned. After installing this app, you have to go on the app Second Prof demo, Second Prof 2.0 demo. This course, you have to join this course. After joining this course, you will get tomorrow's session. It's free. It's like YouTube only. The only thing in the app, we are having much more features apart from the YouTube. There is poll, there is leaderboard. That's why we will take the session on the app. It's same as that of YouTube. It will be Journal Pharmacology episode 2, in which I will continue with the absorption. Then I will come on distribution. That's a real challenge to understand the distribution, volume of distribution. We will do many numericals. So please, please. Okay, so please don't you dare to miss my session. Tomorrow, 19th November on app, and it will be there for free always. If someone is watching this session after 1 year, 2 year, many years on the YouTube, it will remain on YouTube forever. So anytime you can watch episode 2. It is not only for 19th November, it will remain on the app forever. You can later on watch it, but better to attend it live if you people are coming live tomorrow. You can see these are my live demo session. Patho is also available on our app. Micro is also available on our app. Pharma episode 1 is done today. 2 and 3 will be on the app. Episode 2 and 3 will be on app. Episode 2 is tomorrow. Episode 3 is the day after tomorrow. That is Wednesday, Thursday, 19th and 20th. Any other query, it will be entertained on this number. Please, you can take the snapshot. It's a WhatsApp support number. Kindly don't call on this number. Please don't call. You can text your query on the WhatsApp. If you need a call from our team, you can request the call. Our team will call you. Okay, thank you so much. I hope you have understood it. Yes or no? Say. In the end, I would like to tell you something. Here, studying suck. From the last 2 hours, you are with me. I'm just saying, teaching something, you are listening. Sometimes it becomes very, it becomes very difficult for you to retain your attention for long hours. I can understand, because I also passed this phase when I was in your shoes. Okay, so yes, studying sucks, I agree. But you know what sucks more than study? It's your failure. Because currently you are studying, but you don't have regret. When you have failure now, you have regret. You have regret that at that time, if I have studied better, okay, if I have retained better, if I have given my best, this was not the result. Failure sucks. Okay, but if you have tried your best, after that, if there is failure now, there is no sucking. You will say, I have given my best. Even after that, if there is no selection, it's the God's wish. But give your best shot always. Thank you so much. With this, I would like to end the session. First, we will complete absorption tomorrow. A little portion is pending. After that, we will continue with distribution. Thank you so much. Bye-bye. I hope you have understood the session. Any other thing you want to ask? Any other thing you want to ask? Can I end the session? How was the session? Can you give the feedback? You understood the basics of pharmacology, general pharmacology? So general pharmacology is the foundation, people. If you want to excel in pharmacology, you have to make a strong foundation. Okay, chalo. Chalo. Bye bye. Good night. I'm ending the session. Bye.